Welcome to the Alzheimer's and Dementia Summit. I'm your host, Jonathan Landsman. Did you know that every 3 seconds, someone gets diagnosed with Alzheimer's or dementia? In fact, Alzheimer's is the 6th leading cause of death, kills more people than breast and prostate cancer combined, and Western medicine fails to offer a solution. As a health and fitness consultant for nearly 30 years, I believe Alzheimer's and dementia are the most misunderstood, cruelest, and costliest of all diseases. That's why I created this summit, to help you prevent, slow down, and reverse cognitive decline before it's too late. Our show today, Coconut Oil Therapy, Fueling Brain Vitality. Our guest, Dr. Bruce Fife, is a certified nutritionist and naturopathic physician. He is the author of over 20 books, including The Coconut Oil Miracle and Oil Pulling Therapy, Detoxifying and Healing the Body Through Oral Cleansing. In addition, he serves as a director of the Coconut Research Center. Please join me in welcoming Dr. Bruce Fife to our program. Dr. Fife, welcome.
Thank you for inviting me.
It's my pleasure to have you here, Dr. Fife. Why don't we talk about the relationship, to start things off, between Alzheimer's and diabetes?
Well, it is very interesting that actually Alzheimer's is a form of diabetes. In fact, it is now being referred to as type 3 diabetes. And basically what Alzheimer's is insulin resistance of the brain. Type 2 diabetes, is insulin resistance of the body. But in Alzheimer's, the brain becomes insulin resistant. We need insulin in order to shuttle our blood sugar into the cells. The cells can't get, glucose without the aid of insulin. The same thing happens with the brain. And when the brain becomes insulin resistant, it cannot absorb the glucose it needs to function, and therefore it starts to starve and degenerate and die, and this what leads to the cognitive problems associated with Alzheimer's.
I hope people are paying close attention, Dr. Fife, to what you're going to be saying today, because I know it's probably, and I say this generally speaking with a lot of respect to everybody listening, but probably quite easy to think Alzheimer's and dementia are really just for older people, not for me, but the younger people especially. I hope they're paying close attention, because if you're overweight, if you're just feeling tired, if you're pre-diabetic or have diabetes, this is a serious risk for brain disorders later on. I mean, the last thing anybody wants is to forget their best friend's name when they get older, to lose their memory. It's a horrible thing to live your life that way. So again, that's why I appreciate the information you're going to be bringing. Talk to us about this. Do we know what causes the brain to become insulin resistant?
Well, yes, we have some very good indications that show this. And basically, it can all funnel down to chronic inflammation. Chronic inflammation can cause insulin resistance. And there's different ways that the brain can become chronically inflamed. For example, trauma can cause it. It's very interesting that a lot of professional athletes who are in contact sports like football, once they retire and they get older, there's a high percentage of Alzheimer's and other neurological problems with these retired athletes. Other things are drugs. And it's really interesting. A lot of these drugs that can actually harm the brain and promote inflammation are the types that people use all the time. One of the main ones are the statins, the cholesterol-lowering drugs. Other drugs are painkillers, antacids, even drugs used for allergies and colds, that you get over the counter, can cause inflammation. Other things are environmental toxins, like pesticides, even food additives like MSG, nitrates, and things that you see in lots of the foods that we eat. Toxic metals, mercury, lead, and so many people have these dental amalgams, which are 50% mercury. And that mercury is continually leaching into the body. It's going into the brain and causing inflammation up there. And then infections. infections. Obviously, an infection in the brain is going to cause inflammation, but what's really interesting is that any type of infection in the body can stimulate a response, an inflammatory response, which also triggers an inflammatory response in the brain. And so if you have like a bladder infection or a dental infection, these can also trigger the activation of the immune system in the brain, causing inflammation. And also chronic inflammation, such as in arthritis and things like that, can promote inflammation in the brain. And so all of these conditions promote chronic inflammation that can slowly cause the brain to degenerate.
Dr. Fife, I know we have a lot of healthcare providers that are listening to this information, and I really hope they're listening carefully, and everybody else for that matter, because a lot of these conditions that you're bringing up, I know conventionally speaking, nobody is being told, hey, a lot of this is going to be a big risk on your brain function as you get older, sort of dealt with almost, I want to say, quite innocently. Oh, hey, you have some diabetes, take some medication, you have some hypertension, we have to take care of it. All of this really is never taken care of that way, and people are even greater risk for having trouble with their brain as they get older if they don't really address the true cause. Are there any other brain disorders that are influenced by diabetes or insulin resistance?
Yes, pretty much every major neurological brain disorder is related to chronic inflammation and insulin resistance. You look at Parkinson's disease, ALS, Huntington's disease, autism, even strokes and injuries, involve this inflammation and insulin resistance. And so, the same thing applies there as well.
So let's get into this thing that we are hearing a lot about in the last many years for sure, about ketones, and diets that are connected to it. Can you please just first start by explaining what are ketones?
Yeah, ketones have become very popular lately. And basically, what they are is they're an alternative source of fuel to glucose. Our bodies normally use glucose as its primary source of fuel, but it also uses ketones. And ketones are actually a much more potent source of fuel. And ketones are made from fats.
And a lot of people, of course, they want to know the kind of food they're eating, the supplements that they're eating. Obviously, when it comes to ketones, they want to know, where do these ketones come from? How does the body produce them? Things like that. Talk to us about it.
Most of the ketones in your body comes from stored fat. Also, you can get them from dietary sources as well, from dietary fats. And what happens is when we eat a meal that contains carbohydrates, the carbohydrates are converted into glucose, and our blood sugar levels rise, and our body our cells use that glucose for energy. Well, when we don't eat for a period of time, say between meals, when we're sleeping, when we're fasting, then blood sugar levels come down. But our cells, all of our cells, still need a continual supply of energy. And so when blood sugar comes down, then the body starts resorting to stored fat and emulsifies basically the fat, pulls out the fatty acids. And fatty acids can supply the cells with the energy that they need, just like glucose. Now, this process works great for the body, but it doesn't work very well for the brain. The brain cannot use fatty acids to supply its energy needs, so it needs another source of energy, and that is the ketones. And so some of these fats, these fatty acids, are converted into ketones to supply the energy that the brain needs, because the brain can only use glucose or ketones, so it has to have these ketones available.
Dr. Fife, I'm sure you would agree, but I definitely want to get your take on it. In my professional opinion, I think this ketogenic diet, which has gotten very popular in the last few years, has a lot of confusion surrounding it. You've got Atkins, you got high fat, you got everybody saying, I've got a ketogenic diet for you. I'd really like to get your take on all this, professionally speaking. What exactly is a ketogenic diet?
You're exactly right. There's a lot of confusion about it. A lot of people don't understand what it is. A lot of people equate it with like a paleo diet or a low-carb diet, but it's distinctly different. Basically, a ketogenic diet is a very low-carb, high-fat, moderate protein diet. Now, a lot of people kind of assume that a ketogenic is a high-protein diet, but it is not. Too much protein is not ketogenic, and so you need to keep the protein down to a moderate amount. In fact, the amount that the body needs on a daily basis. Distinguishing features about a ketogenic diet is very low in carbohydrates. You need to reduce your total carbohydrate consumption to at least 50 grams a day. At 50 grams a day, some people can get into ketosis. But generally, 40, 30, or 20. In fact, some people have to reduce their total carbs down to as much as 20 grams a day in order to get into ketosis. But generally, about 30 grams a day, most people can get into ketosis. And ketosis is defined as when the body is burning fats and ketones more than they are glucose. So when your body is in that state, you are in a state of ketosis. And in this state, it's a very therapeutic state, and it's very popular for weight loss because at this point you're dissolving a lot of your body fat to convert it into ketones to feed your brain. And ketones can feed basically every cell or every tissue in your body. The brain especially loves them, and requires it, but your heart loves ketones, your lungs love ketones. And since the ketones provide a much more potent source of energy, it's very therapeutic to be in ketosis.
Now, I know a lot of people came to this presentation, Dr. Fife, because it's the coconut oil therapy, and maybe some people are saying, what has all this got to do with it? But I assure you, I've been with Dr. Fife for a long time. His thoughts are very well organized, and this is where our discussion is going to go to another level. And it's important to have this background information, what we just covered, the kind of stuff that you're going to want to listen to over and over again to have a much deeper understanding about what's being said here and to make it really simple for yourself. This is not something you should expect that you understand right away by listening to it just once. But having said that, Dr. Fife, again, a lot of people out there are so easily convinced through, again, quite honestly, conditioning over the years and being taught that, we've got these brain cells and we're surrounded by toxins, or like you were talking about before with football, these brain cells can get destroyed with collisions. And conventionally speaking, they'll say there's nothing you can do about it. Once they're damaged or destroyed, you're finished. You lost those brain cells forever. Is there any regeneration that can take place? What's your opinion on this, please?
Well, for many, many years, the medical profession believed that. They believed that you were born with all the brain cells, basically, that you'll ever have for the rest of your life. And once they die, they're gone forever. But in more recent research has shown that brain cells, just like other cells in the body, do regenerate. New brain cells form. In fact, we have a reservoir of stem cells in our brains that can rejuvenate, can produce new brain cells. So yes, someone with Alzheimer's or Parkinson's disease or another neurological disease, there are potential to reverse these conditions.
That's exactly why I said we're going to be taking this discussion to another level. If you're concerned about your own brain health, or of course, if you're listening to this program because you're concerned about someone that you care about, this is important information. You're going to want to jot all of this down to really understand what to do next. Dr. Fife, going back to ketones again, being called the super fuel for the brain, how can this actually help people with Alzheimer's disease? Talk to us about it, please.
Sure. One of the main things is it provides more energy than glucose. So it's a more efficient form of energy. It's like putting high efficiency fuel into your gas tank. You get more gas mileage, less wear and tear. Your car has more power. The same thing happens when ketones are available to your brain. The brain functions better. Now, one of the key aspects about ketones is that they activate a certain type of protein in the brain called a brain-derived neurotrophic factor. And these neurotrophic factors function in brain cell repair, upkeep, regulation, growth, and regrowth of brain cells. And so when you have ketones available, they're activating these proteins. They're activating the process of reducing inflammation in the brain, of regenerating brain cells, which brings about the healing in diseased brains. Now, another interesting thing about ketones is that they also stimulate blood flow to the brain, bringing in more oxygen, so it produces a healthier brain. And a very interesting thing about ketones is that they provide the basic, not only do they provide energy for the brain, but they provide the basic building blocks for new brain tissue. Believe it or not, in pregnancy, during the third trimester of pregnancy, and the first few months after birth, this period of time is known as the brain growth spurt period. This is when the brain grows the most it will ever grow throughout a person's life. Well, during this time, the infant is in a state of ketosis. And the reason for that is that the infant needs the ketones to go to the brain to provide the building blocks for brain tissue. So it's absolutely necessary, essential for ketones for brain health. And even as adults, we still need ketones coming into the brain on a regular basis in order to provide these basic building blocks so that we can use them to build new brain tissue.
Dr. Fife, no doubt throughout this entire event, people are going to hear this very strong message to be so careful about how much sugar you take in. Sure, natural sugars are fine. Obviously, there's a difference between an apple and chocolate cake when it comes to sugar, but these healthy fats and ketones, understanding the benefits of fueling the brain this way, are so important to stay healthy all the years of our life. Dr. Fife, talk about it as we get into now coconut products in particular, and their benefits to human beings. What exactly are coconut ketones?
Yeah, sometimes you'll hear the term coconut ketones, and that's kind of confusing for people. But basically, what it is, normally when our body produces ketones, the ketones are made from stored body fat. But coconut oil is really a unique substance. It is different from other fats in that it is composed predominantly of what is known as a medium-chain fatty acids. And these medium-chain fatty acids, when you consume them, a significant proportion of these fatty acids will be automatically converted into ketones. And so when you eat coconut oil, you will be producing ketones. And you will be producing these ketones regardless of your blood sugar levels. So even if you are eating a normal diet, even if you're not eating, like a ketogenic diet, your body will convert the coconut oil, the medium-chain fatty acids, into ketones. And these ketones are the same ketones that the body produces from stored body fat or other fats and have the same potential and the same health aspects. They go to the brain. They stimulate the brain-derived neurotrophic factors. They provide the building blocks just as other ketones do.
So obviously dosage means everything, right? Obviously we want the best quality foods and supplementation, but dosage does matter. And naturally, Dr. Fife, people are going to wonder, how much coconut oil does a person really need in order to produce this therapeutic blood level of ketones in a body?
Well, for a maintenance level, for preventative and stuff, I would recommend 1 to 3 tablespoons of coconut oil a day for more therapeutic reasons to build the ketone levels to a more therapeutic level. I would say between 3 and 6 tablespoons per day.
And obviously, people who are concerned so much about Alzheimer's in particular, or even dementia for that matter in general, can coconut oil, in your opinion, be used to both treat and prevent Alzheimer's? I know the medical community, they're going to have like this knee-jerk reaction to even suggesting treating something. Obviously, we are not suggesting that food is a drug, but please talk to us about how you feel coconut oil can be used to help prevent these conditions.
Yes, coconut oil, since it is converted into ketones, it does have a pronounced therapeutic, helpful effect on brain health. And for those who already have some degenerative conditions in their brains, then the ketones are going to help therapeutically with that. If you want to prevent developing Alzheimer's, and Alzheimer's isn't something where you wake up one day and you have it. It's a slow, gradual process. It takes many, many years. And so those people who develop Alzheimer's when they're 65 years old, the process of that started maybe 20, 30 years before that, before they got to that point. And so you can start right now, before you have these conditions, by doing things to prevent it. And one of those things is to add coconut oil into your life. And as I mentioned, 1 to 3 tablespoons a day is a nice maintenance dose, which will help infuse ketones into your body, which will help with brain function. Now, when someone has actually gone to the point where they have some degenerative disease in the brain, then they're going to need a little bit more help, a higher level of ketones. So then they're going to have to go up to 3 to 6 tablespoons a day.
Dr. Fife, I'll definitely want you to spend a minute or so on quality. As I mentioned before, dosage really does matter. You certainly covered that. And people see a lot of different coconut oils on the market. You've got organic, you got raw. I'd love for you to talk about the quality, but in a moment. But just to back up what you were saying, one of the other presenters, the speakers in this event, Dr. Daniel Amen, was talking about how he's got the largest database of brain scans of anyone in the entire world, looking at about 118,000 brain scans he's done over the years. And what he talks about is how even before you get symptoms of Alzheimer's or any other form of dementia, you're looking at this kind of condition developing 30 to 50 years before any symptoms arrive at all. So this is very important that we do things now, day to day, that we enjoy. I'm sure you would advocate that it's something that we enjoy, it's pleasurable, but it's also super healthy to do on a daily basis. That's what it's all about living a healthy lifestyle. So again, having said all that, talk to us, though, about the quality. Are there any things that we should be concerned about in getting, a certain type of coconut oil?
Well, when you go down to the store, you're going to find 2 basically types of coconut oil. One is called a virgin coconut oil, and the other one would be a non-virgin coconut oil. And the basic difference between them is that the virgin coconut oil, like virgin olive oil, has had minimal processing. And personally, I like that the best. I think foods that have had the least amount of manipulation and processing are healthier for us. And so this virgin coconut oil is that type. It will retain some coconut aroma and flavor. The more processed coconut oil will be pretty much tasteless and odorless. Now, some people may prefer that because they may not like the taste of coconut oil and everything they use. And personally, even though I prefer the virgin coconut oil, I actually use both of them because both of them are effective. Both of them contain the medium-chain fatty acids that are converted into ketones. And so you can use either one. When you go into the store, the way you can tell the difference between the two is to look for the word virgin. Only the virgin coconut oils will have that word. Now, they'll have other words associated with it often. They could be organic or natural or something. But even the non-virgin ones will have the same terms, organic, natural, fresh, whatever. So the key word is to look for virgin. If it has virgin on it, it's a virgin oil. If not, it isn't. Now, there's another type of oil that you may see, and it's MCT oil, medium chain triglyceride oil. And basically that is coconut oil that has been fractionated, and they've removed certain medium chain fatty acids from the oil and made it a pure medium chain fatty acid oil. And some people have suggested that since it's 100% medium chain fatty acid, it's even better than coconut oil, which actually is only 63% medium chain fatty acids. And theoretically, you would think it would be. However, personally, I think that coconut oil for general use is better because it contains all 10 fatty acids that naturally comes with the oil rather than just the 2 that are contained in the medium chain triglyceride oil. But both oils have their positive sides. In regards to ketones, the medium chain triglyceride oil will actually boost blood ketone levels higher than coconut oil will. So you get a higher boost. The problem is that this boost in ketone levels only lasts for 3 hours, and then it's back down to normal again. The benefit with the coconut oil is, although it won't raise blood ketone levels as high, it sustains them for a longer period of time, for up to 8 hours. And so when you take coconut oil, your ketone levels are elevated for 8 hours as opposed to just 3 hours with the medium chain triglyceride oil. Now, this is important, particularly for those people who are using the oil therapeutically, is that the brain, an Alzheimer's brain, for example, needs ketones. They cannot utilize glucose efficiently, and so the brain begins to degenerate. But if it has ketones available to it, then it will easily absorb those. Ketones are not affected by insulin resistance, and so the cells readily absorb the ketones, even if in a state of insulin resistance, and so they can feed on them and be healthy. But if the brain does not have ketones and cannot absorb glucose, then the brain is going to start starving and degenerating. Well, if you rely totally on MCT oil, you have to take it every 3 hours in order to maintain that blood level. And that means day and night. So at the night, you'd still have to take the MCT oil to maintain that. And that means you'd be waking up every 3 hours to take MCT oil, because if you didn't have it, then your brain starts degenerating again. However, with coconut oil, you can take it and go for 8 hours. And so you can take it in the evening and feel fine, all night long, because you know that your blood levels will be elevated until the morning, and then take it that way. And so people often are now combining both coconut oil and MCT oil in actually treating Alzheimer's.
Dr. Fife, just for those people out there, we have a lot of healthcare providers that are listening to this. And again, with all due respect, just because maybe they've never heard this information before doesn't make it any less important, a word that you're speaking today. I know you're running an entire research center. Maybe you could just talk to that group of people for a little bit and just say, where all this research is coming from, how many years this has been involved. My point is, you're not just making this stuff out of just reading one book. I know you've written many books on health and nutrition, but maybe you could address those people who are wondering about the research and how long people have been looking at the benefits of coconuts in human health.
Well, yeah, especially with brain health. I mean, coconut oil in general has lots of health aspects that we aren't even touching on today. And the brain health is a very interesting one. Several years ago, I received a call from a doctor in Florida who told me that she was using coconut oil to treat her husband who had Alzheimer's disease, and she had been very successful with it. Her husband developed early onset Alzheimer's. He started getting Alzheimer's in his early 50s. And by this time, he had Alzheimer's for 5 years. And being a doctor, she'd put him on all the medications, and they didn't do any good. And so she was getting desperate. And so she started looking for experimental drugs and wanted to put him into trials of new drugs. And in her research on these new drugs, she found one that showed particular promise. In fact, preliminary studies had showed that the patients that tried it showed remarkable improvement in their memories. Now, this is significant because no Alzheimer's drug has ever shown improvement. The very best that an Alzheimer's drug can do right now is to slow down the degeneration of the brain slightly. None of them can stop it or reverse it, but this one actually showed an improvement, so she was excited, and she wanted to register him to be a participant in the study. And so they went down to do that, and they had her husband, Steve, take the MMSE test, mini-mental state exam, which evaluated the level of Alzheimer's. And when he took the test, he scored a 12, which was very, very low. It was almost into the severe Alzheimer's stage, and it was so bad that he was rejected from the study. He was considered hopeless, and sent home. Well, Dr. Newport, who was the doctor, his wife, had been doing some study on this new drug and found the patent application for it, which contained basically the formula for the drug. And what she found was it contained only one active ingredient, and that active ingredient was medium-chain fatty acids derived from coconut oil. And so since they were rejected from the study, she went down to her local health food store, bought some coconut oil, and then began to give her husband basically the same amount of coconut oil to equal the amount they were giving in the study, which was equivalent to 2.5 tablespoons of coconut oil. And so she put it in his oatmeal the first day, and he took that, and that afternoon they had an appointment with the doctor, who retested him for the mini-mental state exam. And when he took this test, and this was actually 2 weeks from the time he took the test previously, he scored an 18, which is almost into the mild range of Alzheimer's. So just taking the coconut oil one time improved his score that much. And she was so impressed that she continued to give her husband, Steve, the coconut oil every day. And Steve, prior to this, he had lost the ability to type on a computer keyboard. He couldn't spell simple 3-letter words like out or put. He had trouble dressing himself. He would walk around with one shoe and sock on one foot and barefoot on the other. Well, over the next few months, he relearned how to dress himself properly, how to spell again, how to get on a computer. He was able to get on a computer by himself, log in, and surf the internet. And the only thing different was adding the coconut oil in his diet. Now, the makers of this drug that was based on the medium-chain fatty acids provided in their patent application many studies that provided the groundwork for them to develop this drug. So there are lots of studies showing the effectiveness of ketones in brain health and how the medium-chain fatty acids and coconut oil can be used therapeutically to improve those with this condition.
Dr. Fife, very important question to ask you as we close out the program. In your professional opinion, it's so easy, I guess, in a Western mindset, me included, to think, wow, we found something. This is great. It's the magic bullet. but I've often said in most of the hundreds of shows that I've produced at Natural Health 365 that to look for a magic bullet tends to really not be a good way to go. So in your opinion, would you say that just coconut oil is the way to go for people that have neurological disorders, Alzheimer's, dementia, things like this? Or is diet also important? What's your take on this?
Well, diet is very, very important. And so I recommend coconut oil as an aid, as something that's helpful. But if you really want to see progress, if you really want to see some reversal, you need to have a proper diet. Now, I recommend a ketogenic diet. Even though coconut oil produces ketones, a ketogenic diet will enhance the effects of coconut oil and vice versa. Coconut oil enhances the effects of the ketogenic diet. The coconut oil will make a ketogenic diet more ketogenic, so it will elevate your ketones to a higher level so that you have a therapeutic level of ketones 24 hours a day.
And for those people out there who say from vegan to meat eaters, can you do it either way to have a ketogenic diet? Is it more challenging to be a vegan? What's your take on that as we finish up?
Well, you can be a vegan or you can be a meat eater and still get into ketosis. It's probably a little bit harder with a vegan because you eliminate a large amount of types of foods, the meats. But, as I mentioned earlier, the ketogenic diet is not a meat-based diet. The amount of protein you need is just the amount necessary to supply your needs. And so you can eat a vegan diet and still get into ketosis, particularly, and this is very important, that you use coconut oil as a major source of the fats in your diet.
Dr. Fife, I want to thank you so much for your time today, and I want to thank our listeners for joining us. If you would like a copy of this program plus all the other presentations inside the Alzheimer's and Dementia Summit, simply click the banner you see on this page. Thanks again for attending the Alzheimer's and Dementia Summit. Talk to you soon. Take care.